We are having a 2 hours battery backup with this machine. When your machine is fully charged, it will give a backup of 2 hours. Standard 3 probes connectivity is there. 3 probes can be connected at a time with this machine. The control panel of the machine is fully sealed and spill proof. If any kind of jelly or liquid spills on your control panel, nothing will happen to your machine, as it will not go inside the machine and it will not affect your motherboard. So there is zero breakdown. And your probe as well as your machine are 3 feet drop tested. If they fall from 3 feet, nothing will happen to your probe as well as machine. Boot up time of the machine is less than 25 seconds. Single click on and single click off button is there. This is a 2D mode. This is a color mode. This is a Doppler mode, and this is M mode. This is a freeze button. This is for saving your image. This is for saving your video clip. This is for normal calculation like distance or area, something you want to measure. You can take it from caliber button. And if you want to take a dedicated application calculations like in cardiac or in ops gynae, you can take it from the calculation package. This is your depth adjustment. This is your gain adjustment if you want to adjust the gain. This is a zoom. If you want to adjust the any area by zoom, then you can put this box on that area and your zoom area will be zoom out. Again 2D to get the back on the position. And this is a patient button. If you want to do the patient entry, you can do it from here. This is the exam mode. If you want to change the exam, like there are in linear probe, there are different applications, artery, venous, nerve, lung, MSK, everything you will get over here. And you want to change any kind of application, just select that on trackball and then again select, you will get that application over here. Third is option for review. Review is for seeing the previous data of the patients. If you have done any previous patient data, go on the list. There is a data, whatever data you have saved. If you want to transfer that data, go and select that data. Export USB. 2 USB ports are there. One is on the back side of the machine. Connect your pen drive. Your pen drive name will be over here and just export. Your data will be exported to your pen drive. This is 3 different options for your resolution settings. One is general. General works on the mid frequency band, and your resolution works for superficial structures, means high frequency band it works on, and it will give you a superficial structures more clear. And when you are working for deeper structures, you can put on the penetration mode. Your lower frequency will work at that time and you will get the better resolution for the deeper structures by putting on the penetration mode. Second option is for the dynamic range. If you want to get a sharper image, you can go on the negative side. Negative side will do your image sharper, and positive side will get your image like smoother. So your image will become smooth on the positive side and your image will become sharp on the negative side. The third option is of needle guide. If you want to do any kind of biopsy, there are 3 different angles. That depends that which angle where is your target, you have to select. This pointer works as a landmark. If you have set this yellow pointer that how depth you want to go, then while inserting your needle, you don't have to look that how deep you have inserted. You just have to hit this yellow pointer, as this works as a landmark. Fourth option is a dual mode option. If you want to get the dual image on the single window, you can get on the dual image and update. By updating, you will get the second image active. On the second page, there are options. First option is for adjusting the brightness of your image, brightness of your monitor. The second option is for adjusting the pointer. There are 4 options: upper left, up down left, down right, upper right. 4 options are there to adjust the pointer of your probe. The third option is of center line. If you are going for outplane approach in a nerve block, there is a pointer on the probe as well as there is center line marker on the screen as well. So if you are doing a outplane approach or you are doing any kind of line placement, just put your target like this, that this middle line should come on the middle of that target, and you have to just insert your needle by the probe pointer, as well as this dotted line will guide you to go straight in a line. And the third another option for in plane approaches, while inserting the needle, you get the very poor visibility of the tip of the needle, but by owning by active the SMP software, you will get the 50% enhanced needle visibility. And I have 3 different angles for this as well. That depends that how bigger is your target, and if you are inserting your needle from the pointer side, you can do it like this, and if you are inserting from the another side, you can flip your box in the another direction.